Hello. We're here today for our COVID-19 coronavirus weekly update. For those that are in attendance. Right now, we'll start out. I want to introduce Mona Zavante, our health department leader.
Good afternoon, everyone. This is our weekly COVID-19 presentation. We'll be kind of going over some of the same stuff that we've done the last couple of times. I also wanted to just address some of our staff and appreciate everything that the Winnebago Public Health Department, as well as the 12 Clans Unity Hospital, has been really stepping up, taking charge and taking lead on this. And then as well as all the other departments that we're going to hear from today. So I appreciate everybody working with us. And with that being said, I will turn it over to Angela Keller, our Public Health Nursing Director, and she will start with our presentation.
Good afternoon. We're just going to go over a couple of the preparedness and responses that the Winnebago community and the Public Health Department and 12 Clans has done in order to keep our community safe. What the coronavirus is, so as discussed previously, it is a respiratory infection that can spread from person to person. It's a new coronavirus disease that was first identified in Wuhan, China back in late 2019. The coronavirus is a part of a large family of viruses that is commonly seen in animals such as bats. The way this virus was believed to become infected with humans is a bat had infected an animal, which was then ingested by a human. And then the difference between this coronavirus and the other families, the coronavirus is in the other family, within the family, is that it can now spread from human to human. So that's where the concern of this is coming from. With the coronavirus, there are a range of symptoms that someone can experience, anywhere from mild to severe, and in some cases can lead to death. I know that some of these numbers might not be most up to date, but these are the ones most up to date as of yesterday. Currently in the U.S., as of yesterday, there was 44,183 cases in the U.S., a total of 544 deaths. The jurisdictions reporting the cases within the United States, and this does include Washington, D.C., is 54. Travel-related cases within the United States is 479. Person-to-person contact, that's with a known individual that has been positive for COVID-19, is 569. And then currently there's 43,135 cases that are still under investigation. For the state of Nebraska, there's currently 64 cases. There have been 1,304 negative cases, and then in the Winnebago community, there is 0. The symptoms of the coronavirus are those of respiratory illness. The most common ones seen are fever, cough, and shortness of breath. The symptoms can appear anywhere from 2 to 14 days after exposure. If you have known, or if you do know that you've been in contact with somebody that has been positive for the COVID-19 virus, we do want to make sure that you self-quarantine yourself, and then also if you do develop symptoms, to contact your medical provider right away. How the coronavirus is spread. The spread of the COVID virus is from person to person. It happens most frequently within close contact, so that's within 6 feet of somebody, and it's spread through respiratory droplets. So those are expressed when someone coughs, sneezes. Those respiratory droplets are put into the air, and then that's how someone can become in contact with them. It's not thought to be spread with just breathing. It has to actually come out of a cough or a sneeze. People are thought to be most contagious when they're the most symptomatic, so when they're the sickest, when their symptoms are the highest. And then there is research still being done, but CDC is looking into to see if it is possible from the droplets sitting on a hard surface and then somebody touching that hard surface and then touching their nose and mouth. So it would be transferred from that. They're doing more research, but it is possible that it can get spread that way. So that's important for you to know so you can keep your surfaces as clean as possible and clean them frequently and then do frequent hand washing. Everyday precautions that we all should be taking is to avoid contact with sick people as much as possible. We want to make sure we're washing our hands with soap and water for at least 20 seconds, and that's especially after using a tissue to blow your nose, cough, sneeze, or using any public surface or touching any public surface. If soap and water is not available, it is acceptable to use hand sanitizer, but it has to contain at least 60% alcohol. And then you want to make sure, as I had just said, to clean frequently high-touch surfaces, especially within public or within your home. You want to use a disinfectant that is EPA approved to spray and wipe the surface according to the label as the instructions listed on the label. And then take precautions when using those as well. And that's just following the directions as on the label. And then who's at risk for most at risk for the coronavirus infection? Those are older adults and people that have chronic or serious medical conditions. The most common ones that they have found that affect people, that give people serious complications from the coronavirus, is those with heart disease, diabetes, or lung disease. If anybody is at higher risk from getting a serious infection from the COVID-19 infection because of your age or because of a serious long-term medical problem, it is very important that you take actions to reduce the risk of you getting sick. It does not mean that those that are at high risk won't get sick, though, so it can affect everybody. If you are at higher risk of getting a serious complication from the coronavirus, you should make sure that you are stocking up on supplies within a reasonable amount. You just don't want to go out and hoard the supplies. Get the amount that's needed in order to take care of you and your family. Take everyday precautions and keep space between you and yourself and others in the community, and we like that 6 feet, that social distancing. When you go out in public, keep away from others who are sick and limit close contacts with them, and then wash hands often. You want to avoid crowds as much as possible. No crowds should be less than 10. During the COVID-19 outbreak in your community, you want to stay home as much as you can as well. The less exposure you have to public areas and to more individuals, the greater you will reduce your risk of exposure. If you were to get sick, these are things that you can do. You want to stay home except to get medical care. And before you do go get medical care, we do want you to call the Winnebago Public Health Hotline, the ER or your provider, to let them know your symptoms so then they can guide you through the process that would need to be taken to get you in to get seen. And that's for your safety and the safety of everybody in the facility as well. You want to separate yourself from others within your home. You want to try to find one area in your home that you can kind of stay within that area to limit your exposure to those that are living with you. Like I said, you want to call ahead before visiting your doctor or getting medical treatment. If possible, wear a face mask when you are around other individuals. That will protect the droplets from your cough or sneezes to go out into the air. You want to make sure you're still cleaning your hands often, covering all cough, sneezes with a tissue and then disposing that tissue immediately, and then make sure to wash your hands. We want you to monitor your symptoms, and if your symptoms do progress or get worse, then we do want you to call the Winnebago Public Health, the hotline, or the 12 Clans Unity Hospital, so then we can help you work through your symptoms over the phone and to get you the treatment that's needed. The Winnebago hotline is 402-922-1508, and that is available 7 days a week and 24 hours. And then the last thing is just to seek medical treatment if symptoms do worsen. We don't want you to stay home if your symptoms are getting worse, but if they are mild, that's when we're asking for you to self-care at home. And then if you're caring for someone, for yourself or someone at home that has a respiratory illness or COVID-19 infection, we want to make sure that they are covering their coughs and sneezes all times, and that's with a tissue, and then to wash hands immediately. And then follow the same guidelines with washing hands. It's the 20 seconds with soap and water. And then if that's not available, then hand sanitizer for with at least 60% alcohol. And then as much as possible, try to get them to stay in a specific room. That will help decrease the amount of exposure they're getting to other members of the family. If possible, if they could use a separate bathroom, different eating utensils, or make sure they're washed properly after their use. Avoid sharing any personal items with the people within the household, such as eating utensils, dishes, towels, bedding. And if it does, then we need to make sure it is washed properly. And that's just to wash it with the hottest temperature water as possible is what the garment or the clothing will tolerate. And then it's just cleaned with laundry detergent. More information about caring for yourself or someone at home. You want to stay out of public places. You need to stay home as much as possible. That is going to limit the amount of exposure you're giving to anybody within the community. And that's what we're trying to do, is just limit the exposure people are getting to keep them safe and healthy. You want to monitor your symptoms carefully. If symptoms do get worse, call your healthcare provider immediately or call the hotline. It's important for you to get rest and stay hydrated. If you do have a medical appointment or need to seek treatment, call your healthcare provider ahead of time and let them know that you are a positive case of COVID-19 and let them know what your symptoms are, or if you're not or a suspected case, give all that information to the healthcare provider. And then if a medical emergency is needed, call the Winnebago Winnebago Police Department at 402-878-2245 and notify the dispatch personnel that same information. If you've been a known positive of COVID-19, your symptoms, or any information along that. That's going to keep them safe and give them the chance to get the personal protective equipment needed to keep them, to limit their exposure. When to seek medical treatment. Medical treatment is needed if symptoms worsen or if there's any difficulty breathing, shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, if the lips, the nose are starting to become bluish in color on your face, it's important that you do seek medical treatment right away. Like I said, just make sure that someone, or you could call the healthcare provider or the emergency services to come get you, but notify them of your symptoms and what's going on. If a face mask is available, please put one on. If not, then you will be asked to put one on when you arrive to the healthcare facility or if the emergency services come to get you. Again, it is important that if emergency services do come to get you or somebody that you're caring for, that you do notify them of all the symptoms and then the possible COVID-19 exposure or a positive test. With this, there have been some times when someone is sick that we are asking them to self-isolate within their home to prevent any exposures within the community. When to stop that self-isolation. We ask that people stay home and isolate themselves, but they can discontinue this under the following conditions. These three things must all happen together in order for someone to discontinue that self-isolation. We need to have them fever-free for 72 hours with no use of fever reducers, such as Tylenol and ibuprofen. Their symptoms must be improved or getting better, and it has to be at least 7 days from the onset of symptoms. So if all of those three things are not happening, then those three things have to happen together to discontinue that self-isolation. Next is going to be Laura Gamble. She's going to go over some information with what the 12 Clans Unity Hospital is doing.
Hello, everyone. I'm Laura Gamble. I'm the Chief Operating Officer at 12 Clans Unity Hospital. I am also an RN, and I have many years of experience in the healthcare field, plus areas in Northeast Nebraska. I hope everyone is doing well during this time, and everybody is staying safe. I'm going to review a few slides from last week, but then I'm also going to add in a few new slides of process changes that we've had at the hospital. So how has this affected the Winnebago community? We currently have no positive tests or COVID patients in Winnebago, and that was the same as I reported last week. Currently, there are no positive patients in the Northeast Nebraska Public Health Department area. All 12 Clans Unity Hospital, right now, we have one entrance to the building, and everybody must go through the east door. The front door is locked, but we are using that for drive-through pharmacy right now. All patients are now being screened at the door. Patients, if we have a visitor that needs to come, we're going to go over visitor policy too. But everybody is being screened at the door. All individuals that have respiratory illness or symptoms are asked to wear a mask, and that's to protect everybody. That means if you have a sore throat, a fever, a cough, or difficulty breathing, we're going to ask people to put a mask on. Patients are instructed to call their healthcare provider or the COVID hotline at 402-922-1508 before coming in to seek medical care. We would just like to talk to you prior to coming in and kind of see what your symptoms are. So due to COVID-19 concerns and to comply with the CDC guidelines, 12 Clans Unity Hospital and the Winnebago Public Health Department must take steps to reduce the risk of exposure to our community. For this reason, we are implementing a visitor restriction for all areas. Effective until further notice, only one visitor per patient will be allowed in our facility. In the case of a minor or a person with limited ability to understand or communicate, they may accompany that adult, or they could have an adult with them. The adult must be 19 years or older, and either an immediate family member, a power of attorney, a guardian, or a patient representative. Any visitor accompanying a patient must be healthy with no symptoms of fever or the respiratory illness. We ask for your help with enforcement and understanding of our visitor policy. We know it's not ideal, but it's something that we have to do to keep everybody safe. Patients reporting with symptoms right now, like I said, need to wear a surgical mask. And then staff that are attending those patients will also be wearing masks. And we're doing that so that it protects them. One thing we have gotten a lot of questions on is testing. So I'm going to go over a few things with Winnebago and 12 Clans Unity Hospital with testing processes. So when a person comes in and we think they have the symptoms and we may think they have COVID or a possibility for that, we're going to test for other illnesses first, such as strep, flu, or a respiratory infection. If COVID testing is warranted and the Department of Health and Human Services are the ones that help us make that decision, the test is sent to an outside lab. Current turnaround time for test results is 12 to 24 hours with a state lab or 2 to 4 days with a commercial lab. 12 Clans Unity Hospital and most other hospitals our size cannot run the COVID-19 lab tests at this time. Only labs with specialized equipment have the ability to do this type of testing. So all of the tests have to be sent out to a certain lab. Evidence does suggest that greater than 80% of COVID-19 infections are mild. Fever is variable with COVID-19 infection and may be absent. And they might not warrant a healthcare visit or even a lab test. Capacity and supplies of the COVID-19 laboratory testing cannot meet the current demand in the state of Nebraska. A simple clinical diagnosis without the test of COVID-19 infection could include self-isolation and should be the norm, even in the absence of a positive COVID-19 lab test. This could change if more testing becomes available and expands throughout the state of Nebraska. And that slide is directly from the DHHS slides, or the Department of Health and Human Service slides, and we meet with them every Monday, Wednesday, and Friday for updates. In the outpatient department or outpatient clinic, all routine, non-urgent, elective clinic appointments are being rescheduled to a later date, and we're doing that so we can decrease the amount of people that go through the facility. Effective 3/23/20, the outpatient clinic will change to all same-day express care access, Monday through Friday. A patient should call ahead for a same-day appointment. Starting 3/21, there will be no express care clinic on Saturdays until further notice. Plans are in progress to increase telemedicine with eAvera in both the outpatient clinic and emergency department in case any of our providers get sick or we have a significant increase in patients. What we're doing in the emergency department: if you are experiencing mild illness, please call ahead for guidance on whether you should come in or if you should use self-care measures at home. The emergency department is open as usual, but we are working on plans to care for an increased number of patients. If you come to the ED with respiratory symptoms such as a cough, shortness of breath, sore throat, you will be asked to put a mask on and placed in a special waiting room with other patients with respiratory symptoms and away from patients who do not have respiratory symptoms. In the pharmacy is now temporarily filling the 90-day supplies for medications. Starting on Friday, 3/20, a temporary drive-through pharmacy will be in place at the main front entrance or the south side, which is going very well right now. Pharmacy drive-through hours will be Monday through Friday, 8 to 5 p.m. And then patients should call ahead so the medications can be ready for you, and all you have to do is drive up and get them. If you don't call ahead, it's probably going to take you just a little bit longer. Staff will also be wearing masks so that you know when they come out to the car, they'll have a mask on. Over-the-counter medications such as ibuprofen or Tylenol can also be obtained using this drive-through pharmacy. Regular inside pharmacy operations will continue as usual. So other precautions that we're taking: limiting the number of people in the facility to decrease the chance of exposure and to conserve the PPE or protective equipment that we have. Staff in departments throughout the hospital and health department are being rotated, and some staff are teleworking. That means they're working from home or on a leave status. The purpose of limiting and rotating staff is to ensure we can continue operations in case any staff becomes sick. Additional supply orders have been placed, and we are monitoring existing supplies of our personal protective equipment to make sure we have them and we continue to have that throughout this. Again, we are trying very hard to keep track of the personal protective equipment that we have. I'm going to have Mona come up and finish here, and then we'll ask questions later. Answer questions.
So some strategies to stay mentally strong. I know this time is of anxiety, panic, worry, and fear. So we want to make sure that we're sharing reliable information. You want to connect through social media, Skype, and phone calls. Practice self-care. Be mindful of assumptions and check all your facts with CDC or the Winnebago Public Health Department's Facebook page. We encourage everyone to like our Facebook page, I'm just saying. If you are feeling overwhelmed with emotion, there are several hotlines to be that you can access. We have the Suicide Prevention Lifeline, and that's the 1-800-273-TALK. There's also the Nebraska Family Helpline, 1-800-866-8660, or even the Winnebago Crisis Response Line, and that's 712-259-3263, or during business hours, you can call 402-878-2911. We're also trying to change some things up in behavioral health. We're looking at trying to keep our staff safe as well as our patients, so we're looking at doing over the phone or telehealth, so you can call the behavioral health if you're more comfortable with not coming in, and we can provide those services to you. Some of the dispatching guidelines we're moving towards, if you need a CHR or EMS to come to the scene to your home, the dispatch will be going through some screening questions, and this allows us to be ready with personal protective equipment in case you have any respiratory illnesses, that we can be prepared for that. I also want to remind people that this is just for your safety as well as for the staff safety. We only have 9 EMTs that are going to be able to take care of any pre-hospital conditions. So we really need everyone to answer those questions. If you fail to answer the questions and you hang up, you might not get an ambulance right to the scene. So please make sure that you answer those questions when asked. So some of the frequently asked questions that we've been getting, one of them is, are people with asthma more susceptible? And so we've noticed that anybody with a respiratory condition is more susceptible to this disease because it is airborne. So we want to make sure that we're using precautions. It also asks, are people that smoke more susceptible? And that is still yes, because that also relates to the respiratory condition of your lungs. So we want to continue to take added precautions for those people. It says, how will you isolate within multi-generational homes? I know that a lot of our homes have our grandma, our children, and then of course ourselves. And so each one will be taken into consideration. The public health department will look at every single situation and try to find the best avenue for that. So whether that is having just one room for that patient to be isolated in, but we will be looking at that, and every person will be different and every family will be different. So we take those all into consideration. Some of the other questions we've received is the COVID-19 hotline working? It is. So there's no need to call at 4:30 in the morning to see if it's working. It is. We are staffed. Usually 7 to 10 are good hours to call, but we will answer in the middle of the night as best as we can. So all of that staff is working all day long, and then we're manning the hotline at the same time. So I just want to point that out to people. What other medication is recommended besides ibuprofen and Tylenol? There are other over-the-counter medications that can help relieve respiratory symptoms, such as cough suppressant and nasal decongestant. It's also very important to stay hydrated during this time. But if you have any questions, if you have any symptoms, please call the hotline and we can help mitigate your circumstances. Will the shuttle between 12 Clans Unity Hospital and the Siouxland Community Health Center continue? And at this time, we are still continuing. We are limiting the amount of people that are on the shuttle. We are also disinfecting after every trip. So we're just trying to do everything that we can to keep everybody safe on there. We are evaluating almost every day, and if something changes, we'll make sure that we post that on the Facebook page as well as alerting our normal shuttle customers. Why are you asking people not to go to the hospital if they're sick? And I know that's kind of contra than what we usually tell you. We usually tell you if you're sick, go to the hospital. This virus is a little bit different, and so we want to try to contain it as much as we can. So we really want people to try and stay home, but alert us. So call the hotline so we can be monitoring and checking on you every day. Why is the gym still open? So the gym and the pool are actually closed. We do have the workout rooms still available for people. We know during this time is very stressful, so we try to keep those open as best as we can. We do limit the amount of people to 3 in any of the workout rooms. We disinfect every single hour, but if circumstances changes, if we start getting more people in there, we may decide to close those as well. So everything is very fluid, every day changes. We did start to go live today, so that might be something new in the future for everybody. And so on behalf of the entire WCHS team, we appreciate your cooperation to keep our community safe and healthy. Thank you. now Esther Mercer from the Winnebago Tribe of Nebraska CEO is here to present her report.
Good afternoon, everybody. Thank you for joining us today. My name is Esther Mercer, and I am the Chief Executive Officer for the Winnebago Tribe of Nebraska. As many of you are aware, the Winnebago Tribe of Nebraska currently is in shutdown status. However, I would like to again reiterate what I stated last week, is that even though the tribe is shut down and closed to the public, the services that the tribal programs provide to the community are still available to you. Please visit the tribe's website at www.winnebagotribe.com for updates regarding the tribal programs under the tab COVID-19. The tribe is continuing to receive guidance from our various funding agencies regarding how to continue to carry out the goals and objectives of our various grants, which in turn affect the services that are offered to you, the tribal membership. Please be aware that information is rapidly evolving, so I encourage you to visit our tribal website often for the most up-to-date information regarding our programs and services. The Tribal Council recently appointed a pandemic task force consisting of Lance Morgan, Danelle Smith, Alan Post, Mayan Beltran, and myself, and we had our initial meeting this morning. The purpose of the committee is to coordinate services across the various organizations on the reservation to help combat this issue. The tribal administration is currently in the process of evaluating how our organization will operate moving forward, given that the shutdown will most likely be a long-term situation. The situation currently is not unique to our tribe or to our programs. Across the country, tribal organizations, municipal governments, businesses, and restaurants are all in this position of having to balance the safety of our employees with the need to continue to provide services to the public. I again ask respectfully for the community's continued to support as we continue to navigate through this unprecedented situation. Please continue to check the tribe's website and Facebook often for updates as we continue to move forward. Thank you. And with that, I will now turn it over to Mr. Dan Farringer, Superintendent of the Winnebago Public School.
Good afternoon, everyone. My name is Dan Farringer, Superintendent of Schools at Winnebago Public Schools. I have a couple updates here. One is the board voted at the board meeting, a special board meeting last week, I guess earlier this week, to close school through the 17th, revisited on the 14th. But since then, some new updates and recommendations have come out from Northeast Nebraska Public Health Department and also the commissioner, basically stating that they recommend schools be closed at least through April 30th with the idea that, and have a plan that there will be no school for the remainder of the school year. We're continuing to work through that. One of the other questions that keep coming up is graduation. We are working on a plan, something to honor the graduates. We'll have more information at a later date. We're still trying to come up with ideas how to be safe, but still give the kids the honor they deserve. I did email Garen some information this afternoon earlier that the governor is going to have a town hall meeting. It will be on, I believe, NET and some of those stations. He's going to be sending that out to the tribal website. You guys can, anybody can get on. The information is on that information that I sent to Garen earlier. It's regarding the COVID-19 and how the state is responding. Another update I want to share with you is we've had some glitches in our food service. We're still feeding lots of kids in the community, but sometimes somebody calls for a delivery, but then it takes a lot of times when we're delivering 400 to 500 meals, so they might not get there, so they drive through and the people at the window don't know that they were on the delivery route, so they give them, and so we have ran out. We're working on that. we've had meetings, and the food service people and those that are delivering have been working hard and will continue to work hard and come up with new ideas and try to iron out any glitches that come up. One thing that will change next week is that we will be delivering twice on Mondays, which will be breakfast and then at lunchtime, but also with the lunches Monday through Thursday, you will get with the one delivery, you'll be getting breakfast for the next day. So on Monday morning, you'll get a delivery for breakfast. Monday at noon, you'll get a delivery for lunch Monday and breakfast on Tuesday. And then we're going to try to avoid the less interaction and travel and things like that we believe will help combat the COVID-19 issue. Now, with that in mind, next, I believe it's next, or in Friday the 10th and April 13th, Monday, that is Easter weekend. There will be no food service. So on that day, they'll get the lunch delivery on Thursday. They'll get a delivery on Tuesday morning for breakfast, and then Tuesday afternoon, they'll get their lunch for Tuesday and breakfast for Wednesday. It's a work in progress. One of the other things we've done is we've asked parents, is this going to be for the whole year? That's going to avoid less call-ins. And we've had, I believe we're up to 400 parents say yes, either for delivery or pickup. So we're working on that. We continue to work on that. One of the things, Pearl, and it will be on our website, and I'll get it to Garen, just some ideas, and it follows up with everything that's been said. One of the things with the sacks and everything, please wash your hands before you eat the meals. Try to eat the meals as soon as possible. And here it comes in. If you receive more than one meal, which you're going to do because you're going to get breakfast, put it in the refrigerator. Rewash fresh fruit. And you can check the temps. Heat it up if you need to. We're basically going to go dry for the most part. There will be some things that can be heated up. Check if you leave the food sit around. Please check the expiration dates on processed items. And if you haven't eaten the food in 4 days, please throw it away. The other thing I just want to bring up is we'll continue to get as many packets. We're trying to limit the traffic in the building. I've been working with the construction companies, trying to limit that, getting schedules so that we're trying to keep them out of the existing building as much as possible. We still want the other part of the building done. But, so we'll keep working on that. Also, our staff, we've worked with some things. Our board has been very supportive on how to maybe cut down some of that, and some of the at-risk employees will be taken care of as long as possible. Those are some of the updates. Again, the teachers will be sending out that information through the principals. Mr. James does a good job with the Alert Now, and we'll get as much on the website as we can to try to keep it as current as we can. Thank you again and we'll get through this.
Good afternoon. My name is Sam Burish. I manage communications for Ho Chunk Inc. In the interest of time, I'll just review our biggest items today. The company has formed a COVID-19 task force with leaders across the organization. The three things they're working on right now are reviewing federal legislation and government contracting opportunities to maximize the benefit to the tribe and Ho Chunk Inc. We are updating policies, procedures, and guidelines for the safety and well-being of our employees and the communities we serve. We've also increased internal and external communications, including guidance to managers, access to mental health and other resources. For our retail operations, we understand the Pony Express convenience stores and Sweetwater cafes are vital to the communities they serve. Our goal is to keep these businesses as operational as possible with employees and customers' well-being in mind. Last week, we reduced hours at the convenience stores and the cafes went to takeout only. This Sunday, the Atticad location of Pony Express in South Sioux City will begin being closed on Sundays for additional cleaning and restocking. With all of our stores, we'll continue to evaluate the locations and make any adjustments as necessary. For the hours, visit those businesses' Facebook pages. The hours do vary. They're posted online and also on the doors of those businesses. For our office locations, visitors will be by appointment only. If you do need to visit that office location in person for some reason, schedule that appointment with an employee in advance. For our workforce status, we have a telework rotation plan that allows us flexibility as this situation evolves. Many roles across the company are able to be completed remotely, and we've put that technology in place. In conclusion, we've been proactive as possible, taking this day by day. We're doing what's best for employees and looking out for ways to maximize the benefit to the tribe through relief efforts. Thank you.
Good afternoon, everyone. My name is Emily Longuski, and I am the Communications Manager for the Winnebago Comprehensive Healthcare System. At this time, we're going to invite Mona, Angie, and Laura back up for a Q&A session. Before we do that, though, we do have a statement for Little Priest Tribal College. They sent along an update and a statement, so I'll just read it off. They have donated 26 dozens of eggs and other food items to the senior center. They're evaluating whether to push the semester to completely online with the Board of Trustees. Faculty and staff are in constant contact with the students. All school operations are going smoothly. They're brainstorming different strategies to keep the enrollment up in the summer semester. And all buildings, including the dorms, are disinfected and cleaned again. And they wanted to send the message out to everybody to stay safe as well. So at this time, Laura, Mona, Angie. So we had questions submitted via email and on our Facebook page. If you have any questions regarding COVID-19, please email covid@winnebagotribe.com, and we will do our best to answer them in our weekly live stream updates. So the first question we got was, how many COVID-19 test kits does Winnebago have?
All right, so as far as how many tests we could do right now, it depends on which lab we're using. With the health department, that's the state health lab, we have the ability to send 36 tests to the state health lab. And that all has to do with the type of medium that we send the tests in. It's not a normal test that we would do on a daily basis. So we have tried to get more, everybody in the state has tried to get more of that type of medium. The lab, that's a commercial lab, which is Quest. They are looking at being able to, for us to test with just normal saline and have that be the medium that we use, and we have plenty of that. So we would be able to, when that comes available, we would be able to send 200 tests in.
And in regards to that question, we had a couple people asking if we have been testing, and if so, how many tests have we done?
We've only done one test. We've only sent one test in. We have to follow a very strict protocol with the state health department. They guide us through that, and there's certain things that have to be met in order for us to do any testing. And one is they have to meet the requirements of, they have to have the risks that Angie went over, older adults, and then they have to have some of those health risks. And then they also have to meet all the screening. They have to have the symptoms, they have to have been traveled somewhere, and they have to have been exposed to somebody with COVID. You want to add anything to that, Angie? Or?
The only other thing is, if with community spread, it's not yet in this community, but once that does happen, they will probably give those guidelines a little bit of variance, but right now those are what we have to follow.
I do think the testing, we meet with the health department every Monday, Wednesday, and Friday, and every time they tell us there's going to be more testing in Nebraska, and so every time everybody asks that question.
And along with that, we had a lot of questions about the timelines for the tests. Can you elaborate on that?
Yeah, so if we use the state health lab, which again has to be approved by the state, we can get those tests back within 12 to 24 hours. If we're using the commercial labs like Quest, right now it's taking 5 to 7 days to get a test back. It varies on which lab we use.
We had a question via Facebook. Are there any confirmed cases in Thurston County?
As of right now, there are no confirmed cases in Thurston County.
What should I buy to prepare for COVID-19?
So good options for things to buy would be household supplies. So a reasonable amount of toilet paper, paper towels, disinfectants. It is a good idea to have any over-the-counter medications that could be anticipated to be used. So that would include Tylenol or ibuprofen. Those can be generic. And then cough suppressants, nasal decongestants, Kleenex or facial tissues are good options as well to have on hand. And then also just with that, it's a good idea to have a plan for you and anybody in your household, especially if you are living alone, to see if somebody would be able to come and take care of you if you were to become ill, or if you could help somebody else out that would become ill as well.
Another question, if I get the virus, self-isolation in my home is recommended. Do I have to separate myself from my family, and what is the most effective way and for how long?
I can take that one.
Oh, you want that one? Okay.
So if you do get the virus, self-isolation is the best course to help prevent any exposure to anybody within your household. The best way to do that is to limit your contact with household members as much as possible, or keep that distance. If it is possible, to kind of isolate to one room, and if there is another bathroom available, to have that one bathroom be for that person, and then have it wiped down in between use. That's going to reduce the biggest risk of exposure. Is there a second half to that one?
They asked how long?
How long? So with the isolation, there's those 3 things that need to be met in order to discontinue isolation, and this should be with any respiratory illness, not just the COVID virus. You have to be fever-free for 72 hours, and that's without the use of any fever reducer medications, so that includes Tylenol or ibuprofen. You do need to have your symptoms be gone, or at least starting to improve, and then it has to be 7 days from the time of the first time your symptoms were there. So from the 7 days from onset of your symptoms. And all 3 of those need to be met in order to discontinue your self-isolation.
If a person has 1 or 2 symptoms, although not enough for medical treatment besides self-quarantine, what other at-home recommendations are you suggesting? They want to know if there's anything working in other places you've heard of.
With those, unfortunately, there's not a cure or a medication that's going to alleviate this virus. The thing to do is we have to care for the symptoms. So those most commonly are fever, sore throat, difficulty breathing with a cough. So like I said, it would be your Tylenol, your ibuprofen, or those generic forms of those, the cough suppressants, nasal decongestants, and just to have your household items on hand to prepare yourself as much as possible so you can limit the amount of people that need to come into your house to help you, or to go out to get those items as well.
And then this is actually our last question. A couple people have asked, when they've called in, they were told to stay home and take ibuprofen, as you mentioned. Can you explain this process, and why, if people believe they have symptoms, why should they stay home and not even get tested?
Are you taking that one, Mona? Or?
Angie's on a roll.
Okay, Angie's on fire. Go, Angie.
So the reason for that is we want to limit the amount of exposure within the community and within our healthcare workers without having them kind of self-care at home. I know that Mona touched base on this. This virus is different than any other virus that they've come across. And so we kind of have to treat it a little bit different. We're not telling you not to, if you need medical treatment, we want you to come in and be seen. but with mild symptoms, it is best to self-care, and that's just to reduce the risk of exposure within your loved ones, within the healthcare workers, and within the community. We just want to keep everyone as safe and as healthy as possible.
And we actually just got another question in. So this is sent on behalf of WHDC. Since our employees choose to continue to work rather than stay home, is there any local protocol if one of our employees does get very ill and it is confirmed that they have COVID-19? Does it warrant a shutdown or not yet determined beyond the sick person goes home?
So for our housing entities, I know that Angie from the Public Health Department, along with other public health nurses, will be working very closely with whatever entity it may be, but also some precautions that housing can specifically take if they're going to continue to go into people's homes. I would suggest for emergencies only, make sure that they have masks on, limit their interaction with other residents within that household, and then if they need to shut down, I guess it would just depend on how many staff it may affect at one given time. And of course, we always ask the elderly to kind of stay away from others during this time, because the illness has affected them a little bit differently than younger people. But younger people are still getting this disease, and so I don't want us to not be mindful that we should all be taking precautions.
Great, thank you. And we did actually get a statement from the Bureau of Indian Affairs office, so I'm going to read that before we wrap up. Currently, the BIA office is open with a limited number of staff in the office to provide services and will remain open until further notice. If you are in need of assistance regarding probates or any land transactions, including land sales, gift deeds, leases, etc., please call 402-878-2502 to set up an appointment, as we are currently practicing social distancing and want to limit the number of clients in the office at any given time. If you are inquiring about your annual lease payout or have the need to update or change your address, you can call the Office of the Special Trustee, Trust Beneficiary Call Center at 1-888-678-6836. Currently, all OST agency personnel are teleworking and not in the office. With regards to Tribal 638 funding, the regional office is trying to get all appropriations to the tribe as quickly as possible. So with that, I think that wraps up our COVID update for this week. I would just want to remind you to like the health department on Facebook at Winnebago Public Health Department, and the hospital on Facebook as well at 12 Clans Unity Hospital, and send any questions you might have for next week's to covid@winnebagotribe.com. Thank you very much.